Right. So today we want to begin by looking at the endocrine system. The endocrine system. So basically the endocrine system refers to the hormonal system. That's another name, right? The hormonal system. So when say an endocrine gland, we are referring to a gland that has no ducts, right? What we call a ductless gland. So this is a ductless gland, right? There are some glands that have ducts. Those that have ducts, we call them exocrine gland. So exocrine, when we say exocrine, exocrine gland. These are glands with ducts. All right. So when I say duct, that's just an opening through which they release their secretions, right? The chemicals that they release, called them secretions. So you have maybe the cells like this, and it's an opening to the surface. So this would be the cells. So this would be the gland. And then this would be the ducts, the opening to the surface, the ducts here, all right? But we are talking about endocrine. So when we say the endocrine, as I said, no ducts. So for the endocrine, they'll have no opening to the surface. So we just have the cells. Let's say it is the cell. Then you're going to have a lot of blood vessels coming in. So you have blood vessels that will go in and out, a network of blood vessels. So these are blood vessels. Okay, they go in and gland, in and out of the gland, right? So if somebody sees something under the microscope like this, a gland that has blood vessels entering and leaving, then the person is looking at an endocrine gland, you know, so there are questions like that too, right? So the secretions that are released directly, so the secretions are released directly into the blood. So the endocrine glands secrete hormones that regulate various metabolic activities in the body, right? So this is a good diagram of the different types of endocrine glands that we have. Very good diagram. Sometimes they give you the diagram and then they will label them 1, 2, 3 and ask you to identify what they do. There's a question in the book that we're going to use to illustrate what I'm talking about. But for now, let's go through the various glands quickly, overview of the various glands, right? So the first one I want us to look at is the hypothalamus and then the pituitary gland. Those are the two we'll look at. So the hypothalamus. Yeah, 1 second. My pen is frozen here. Let's see. Okay. Okay, so good. All right, so let's talk about the hypothalamus. Okay. Now the hypothalamus produces what we call the releasing hormones. So anything that had the word releasing attached to it, releasing hormone, then that hormone comes from the hypothalamus, right? So some of them are the thyroid releasing hormone, what you have here, thyroid releasing hormone. And then you have CRH, corticotropic releasing hormone. Then GHRH, that's growth hormone releasing hormone, right? Those are the hormones released there. They also have dopamine, and then you have somatostatin and vasopressin. These are all hormones released in the hypothalamus. Okay. The hypothalamus controls the pituitary gland. So it acts on the pituitary gland, and then the pituitary gland would also produce its hormones. So if you look at the hypothalamus, it will look something like this. And then you see the pituitary hanging under it. Let me get rid of this one here. So you have the hypothalamus like that, and then the pituitary will be hanging under it like this. Okay. So this will be the pituitary, and this hypothalamus. The pituitary has two parts. Has a what we call the posterior part, pituitary, and then the anterior portion. Okay, right. So that is somewhere here. What we're seeing, somewhere around here. Okay. Now the hormones that the pituitary releases are GH, which is growth hormone, TSH, thyroid stimulating hormone, ACTH, adrenocorticotropic hormone, FSH, and so on. LH, prolactin, oxytocin, and vasopressin. Now, all these ones are released from the front, from the anterior part. This here. Okay, let me write that here. So for the anterior part, you have the growth hormone. Sorry, my pen is acting off a little bit. Let's see. Okay. So you have the, hold on for a second, my pen is acting up here. Okay. All right, let's come back. So they have the growth hormone. Released from here. You have prolactin. I have a summary of the functions typed out, so I'll show you after I finish. Then we have follicle stimulating hormone, which is the FSH. You have the luteinizing hormone, the LH. Luteinizing. luteinizing hormone. And then you have thyroid stimulating hormone. That's the TSH. Okay. So those are the hormones released by the anterior portion, right? And then the posterior part, there are two hormones that are released here, and those are oxytocin and what we call it ADH, anti-diuretic hormone, ADH for short. Okay. One more for the anterior part, we have ACTH, which is an adrenocorticotropic hormone. That's the ACTH for short. Okay. Now, what you have to remember here is the fact that the anterior pituitary produces hormone. So the anterior part produces hormones, whilst the posterior one, it does not produce hormone. It just stores hormones from the hypothalamus. So the hypothalamus produces these hormones. They produce the hormones that go through into the posterior part. Okay. So note, anterior produces hormones. Posterior pituitary stores hormones produced by the hypothalamus. Okay. So that's what it does. Okay. So now let's go through the functions here. I've listed some of the functions here to make it easy for us to follow. Right. So I said that hypothalamus produces 8 hormones. Some of the hormones stimulate the pituitary to produce other hormones, right? As I've just discussed. They have the thyrotropin releasing hormone. This acts on the pituitary to release the thyroid stimulating hormone, TSH. Then growth hormone releasing hormone. This is going to act on the pituitary to release growth hormone. Then gonadotropin releasing hormone. This acts on the pituitary to release gonadotropins, namely the follicle stimulating hormones, FSH, and luteinizing hormones, LH. Corticotropin releasing hormone. This acts on the pituitary to release adrenocorticotropic hormone. Oxytocin. This causes the uterine contractions and also helps in secretion of the breast milk during lactation. All right, that's oxytocin. And then dopamine. It's a neuroendocrine transmitter. It acts on the neurotransmitter and also stimulates the release of other hormones. So that's the function of dopamine. Then vasopressin, ADH. The ADH acts on the kidney to prevent the loss of water via the urine. So if somebody is like it helps to prevent like dehydration by helping you to retain water in the kidneys. Then somatostatin, this inhibits the release of growth hormone. So these are the hormones that the hypothalamus produces, right? So the key fact is that it produces what we call stimulating hormones that act on the pituitary to produce other hormones, right? So the pituitary gland, as I said, has an anterior portion, the hormone producing portion, and a posterior portion called the neural portion. It's an extension of the hypothalamus, as I just drawn. So two hormones, oxytocin and ADH, produced by the hypothalamus are stored in the posterior pituitary for later release, right? And then you have the 4 of the 6 pituitary hormones that we just discussed. They are called tropic hormones. They regulate the function of other endocrine glands. So another term for the pituitary gland that you come across, some people refer to as a master gland, the master gland. So they see the master gland, you're talking about the pituitary gland. Today, I don't know, there's something, the software is not operating well with the pen. Yes. Okay, let's go through to come back. All right, so we discussed this already. Growth hormone, the growth hormone stimulates the growth of all body tissues, but especially skeletal muscle. So that's a growth hormone, right? Growth hormone. The growth hormone mobilizes fats. It also stimulates protein synthesis and inhibits glucose uptake and metabolism, right? Overproduction of growth hormone leads to what you call gigantism, right? So somebody produces too much growth hormone in the growth phase, then the person will become like a giant, and that's what we call the gigantism. Whilst if there's underproduction will lead to dwarfism, so the person becomes short, known as dwarfism, right? Then you have the thyroid stimulating hormone, TSH. The thyroid stimulating hormone, this promotes normal development and activity of the thyroid gland. Normal development and activity of the thyroid gland. So thyroid stimulating hormone. So it will cause the thyroid gland to produce other hormones, which we're going to talk about shortly. Then adrenocorticotropic hormone, ACTH. This stimulates the adrenal cortex to release the corticosteroids. Okay? So it acts on adrenal glands. Then you have the gonadotropin, which is FSH, and luteinizing hormone. These regulate the functions of the gonads in both sexes. So you have follicle stimulating hormones that stimulate the sex cell development, right? Development of the eggs and the sperms. And then you have LH that stimulates gonadal hormone production of hormones by the reproductive system. And then you have prolactin. Prolactin, this promotes milk production in human females, right? And as I said, the posterior portion stores and releases two hypothalamic hormones, oxytocin. The function of oxytocin is to stimulate uterine contractions. So it causes the uterus to contract during labor and delivery of babies. It also causes milk ejection in nursing mothers. So milk ejection when babies breastfeeding. Then the antidiuretic hormone, ADH for short. This stimulates the kidney tubules to reabsorb water and conserve it. So it conserves water. This results in the production of small volumes of highly concentrated urine and decreased plasma osmolarity, right? So, and then underproduction leads to a condition called diabetes insipidus, where the affected person passes a lot of diluted urine, right? So somebody without a low amount of ADH or will have what we call diabetes insipidus. their urine, they pass out a lot of urine, which is very diluted. Okay, so these are the functions of the hormones of the pituitary gland, the pituitary gland. So pituitary, as I said, is also known as the master gland. It's like conductor of the orchestra, you know. Yeah. All right, so let's look at the thyroid gland. So the thyroid gland is located here, somewhere in the front part of the neck, anterior part of the neck, right here. Okay. Thyroid gland. And within it, you see there's some 4 structures, a pair on each side, those dots, right? Those dots, those are the parathyroid gland, the parathyroid gland. The big one is the thyroid. So the thyroid, the function of the thyroid is to produce what we call thyroxine, thyroxine. And so first one is called thyroxine. So it produces the thyroid hormone, which includes thyroxine, T4, and then we have triiodothyronine, T3, right? So T4 has 4 iodine, and you have iodine molecules, and T3, that's the triiodothyronine, has 3 iodine molecules. That's called T3, and then the 4 thyroid. So we need iodine to produce the thyroid hormone. Iodine is needed to produce a thyroid hormone. Okay. So it's very important to know that iodine needed in thyroid hormone production. Iodine is needed. Okay, so if somebody lacks that, you have a problem with iodine. So those who have deficiency of iodine, sometimes you see a swelling in the anterior part of the neck. It can become very big. If you get a chance, you can look on the internet, you see diagrams. It causes what you called goiter, deficiency of iodine causes goiter. So goiter is swelling of the thyroid gland. Once they're given iodine, it goes away very quickly. That's why they put salt. Sorry, that's why they put iodine in the salt, the iodinized salt. So most of the time we don't see the deficiency too much over here, but other developing countries where there's deficiency is very common. Okay. So remember this, deficiency of iodine will lead to swelling known as goiter. Okay. And the function of the thyroid hormone is to control metabolic activities. So I have here, it increases the rate of cellular metabolism, right? Increase the rate of cellular metabolism, function of the thyroid gland, right? So when you start pathophysiology, you were talking about the abnormalities, right? So when it's low, when it's high, what happens? You talk about that in pathophysiology. But just a quick idea. If the thyroid gland is very high, we refer to that as hyperthyroidism. So hyperthyroidism is high levels. Hyperthyroidism. High levels of the thyroid hormone, which you call the thyroxine. Okay, so it means that this person is going to have a high metabolic rate, very high metabolic rate. Everything's so up there. And because they have a high metabolic rate, you see that they end up generating a lot of heat. They produce so much heat. So they feel very hot. So the room will be okay, everybody's fine with the temperature, but then they'll tell that it's too hot in here, and they get easily agitated, they have difficulty concentrating, And then they eat a lot, but then they don't gain weight. They still lose weight, okay? Whilst the low levels, known as hypothyroidism, hypo, remember low. So low levels of thyroxine. Now, for them, their metabolic rate will be very low metabolic rate. So they don't generate a lot of heat. So everybody will be okay with the temperature in the room, but then they will tell them that they feel so cold. They feel so cold because they can't generate heat to maintain their temperature. And they have low metabolic activity. So they don't eat too much, yet they are still putting on a lot of weight. And they have difficulty like thinking. They also have difficulty thinking. So that's hypothyroidism. Okay. Then the other hormone that is produced by the thyroid gland is called a calcitonin. Calcitonin, as you have here, calcitonin, right? So the calcitonin is produced by what we call the parafollicular cells. The parafollicular cells. All right. So the function of calcitonin is it decreases the blood calcium levels. So it decreases the blood calcium levels. That's the function of calcitonin, decrease. All right. Then we have the parathyroid gland. The parathyroid gland, as I said, those are the small dots that we see in the parathyroid, a pair on each side. And the function of the parathyroid gland is to produce the parathyroid hormone, which we call the PTH. PTH. And the function of the parathyroid hormone, that one is to increase the calcium level in the blood, increase the calcium level. Okay. And remember, calcium is largely stored in the bone, right? In the bone. So if the level goes up, then the calcitonin will be released, and that will cause the blood, the calcium in the blood to go back into the calcium in the blood to go back into the bones to be stored, right? If the levels are low, then parathyroid hormone will be released, and that will cause the bone to release calcium into the blood. Okay, so they antagonize each other. Then the other gland we want to look at is the thymus. The thymus, right? Now the thymus produces what we call thymopoietin. Thymopoietin, right here. Thymus gland. Okay, it's somewhere behind the sternum. Now in the adults, let's say, in fact, just after birth, the thymus vanishes. It ends up vanishing after birth, right? Because it has already performed all its functions. Now the function is to school the lymphocytes, the T lymphocytes. So thymus, we call that a vestigial gland. It's a vestigial gland. That means it becomes tiny. So vestigial. So it vanishes or becomes small. Okay. And the function is to school. It schools the T lymphocytes. Okay, so the T lymphocytes go to school here to be educated, so that they can recognize the self. So they don't destroy your tissues. So they school the T lymphocytes to recognize the self. So they know that it is you. When they see your tissues, they don't destroy them. Remember, the T lymphocytes fight viral infections and other things, and with cancer cells and so on. Okay. So there's a theory that those who have autoimmune disease, there's a theory that their lymphocytes, that the T lymphocytes were not trained very well to recognize their tissues. So that's why they are damaging their tissues. Okay. The T lymphocyte produce chemicals that help in fighting infection. Okay. So that's the thymus. Usually vanishes by birth. And then we have the pancreas. Pancreas right there. Okay. So the pancreas, we want to talk about insulin, glucagon, and somatostatin, right? The hormones that the pancreas produces. So the pancreas produces, so the pancreas is both an exocrine and endocrine gland, right? So that's a gland that has both functions. We'll talk about the exocrine function when we come to digestion, the exocrine. So it's very important to know it has a dual function, both exocrine and endocrine. Okay, so exocrine, as we said, has ducts. Endocrine, the part that has no ducts, is known as the islet of Langerhans, the endocrine portion of the pancreas, the islet glands, the islet of Langerhans. So they release insulin and glucagon, the islets of Langerhans. So those are the hormones I want to talk about here. Okay, it also releases small amount of other hormones into the blood. Okay, these are not the only two hormones. There are other hormones released. And like as I said, somatostatin is also released. But we want to focus on insulin and glucagon for this particular exam, right? So glucagon is released by what we call the alpha cells, the alpha cells. And the function of glucagon is to increase the glucose level in the blood. So glucagon increases, whilst insulin released by the beta cells, they decrease. So they reduce the calcium level in the blood, reduce. So insulin reduces, whilst glucagon increases, right? Very important to remember these two things. Okay. It increases the rate of glucose uptake and metabolism by most of the cells. That's what insulin does. So we know that if somebody has deficiency of insulin or insulin is not acting well, then the person will have diabetes, right? Diabetes. So that'll be deficiency of the insulin. Either it's not produced well or it's not functioning well. You have diabetes, high sugar levels. Okay. We'll talk about the exocrine part of the pancreas when we talk about digestion, okay, where it will produce digestive juices and enzymes. So under digestion, we'll talk about that. Okay. So these are the two hormones that common hormones produced by the pancreas that is good to know for this exam. And then we also have another gland, which is the, let's talk about the adrenal. Now, before we talk about that, let's go back here. There's one, the pineal gland, right? The pineal gland produces what we call melatonin right here, melatonin, okay. And melatonin, the function is to control our sleep and wake pattern, what we call the circadian rhythm, all right? And it's affected by light. So that is the pineal gland, melatonin. Okay. And then we also have the adrenal gland. So the adrenal gland is here on top of the kidney, adrenal gland. So the adrenal gland produces what we call the androgens, the glucocorticoids, adrenaline and noradrenaline. Right? Those are the steroid hormones, what we call the steroid hormones. So if you go down here, I have it here. Okay, let me check. I think that is not here. All right, so let's put this down. I think I didn't put this here. So the adrenal gland. So as we said, it produces what we call the corticosteroids. Or the steroid hormones. Okay, so the first one that I mentioned was the glucocorticoids. You have glucocorticoids, right? Glucocorticoids. So the word gluco, so it means that it plays a role in metabolism, like when it increases metabolic activity, especially during stress, right? So some people call it stress hormones. So they increase glucose metabolism. During stress, right? So stress can be regular, like stressed over something, or you are even injury. Injury is a form of stress, healing of wounds and so on. They play a role in that. Then we have the other one called the mineralocorticoids. Mineralocorticoids. Okay. So the mineralocorticoids, they play a role in metabolism, or they regulate mineral exchange in the kidney. Regulate the exchange of minerals, like sodium and potassium, exchange of minerals like sodium and potassium. In the kidney. An example of this is what we call the aldosterone. An example of mineralocorticoid. Example, aldosterone. Right, that's an example of it. Now, all these are produced in what we call the adrenal cortex, right? The adrenal gland has two parts, the cortex, and they have the medulla part. So this is produced by the adrenal cortex. Okay. The outside of the adrenal is adrenal cortex. Now my pen ends up freezing today. Okay, it's back. So this is called the cortex of the adrenal, and then the inner part is called the medulla. Okay. So all that we spoke about, these are all from adrenal cortex. Okay. Now the medulla part of the adrenal cortex, that one you produce the, over here, you don't produce your adrenaline and what we call noradrenaline. Okay. So they play a role in fight and flight, right? So that's a function. Okay. All right, so this should be enough for the adrenal gland, right? And then we come to the gonads, So the gonads, the ovaries of the female release two main hormones, estrogen and progesterone. And then you have the estrogen stimulates maturation of the female reproductive system and development of the secondary sexual characteristics. So that's what the estrogen does. And then you have progesterone, which works with the estrogen in establishing the menstrual cycle, all right? And then in the males, the testes release the testosterone in the males. It also promotes the maturation of the male reproductive organs and the development of secondary sexual characteristics and the production of sperm by the testes. Okay, so these are the functions of the hormones produced by the gonads: estrogen, progesterone, and then the male's testosterone. Okay. And then the pineal gland, I mentioned that already. It produces melatonin, which influences daily rhythms such as sleep and wake patterns. Yeah, and it needs light. Light is very important for this. So it said that if you work in the night, those working in the night, it's good to turn off the light a little bit, you know, stay in some darkness so that it doesn't change your circadian rhythm. Right. And then we spoke about the thymus already. So these are the notes that you can use for the thymus. It's an important organ of the immune system during developmental stages of life. It vanishes by the time of birth, and the T cells mature over here, as I said. All right. So this is the overview of the endocrine system. Any questions on this one before we move on? The endocrine system in general. If you know this, you should be able to answer almost every question that they ask you on the test. Any questions on this?
No, Professor, thank you.
All right, so far, okay, good. So before we proceed, let's go to the textbook, page 223. There's a diagram over there that I want us to look at based on this question, based on this topic. Page 223. And the questions are 29 through 31. 29 through 31. So let's see if we can apply the concept. All right, I believe you're all there. Okay. So 29 says, the function common to the organs of this system is, so you have a diagram that looks like what I have here. All right, and it says label 1, 2, 3, and so on. So the function common to the organs of this system is A, reproduction, B, secretion, C, respiration, and D, excretion.
B.
B, yeah, secretion, right? Because that's a hormonal system. And then 30, it says, which of these organs controls the amount of calcium in the blood? The one that controls the calcium in the blood. Then you have 1, 2, 3, 1, 2, 3, and 6.
C.
A, 1, which one? C, yeah, 3. Because it's pointing to the parathyroid gland. Those two, yeah, the small dots in the thymus. Great. And then 31, it says that which of these organs has the added function of producing digestive enzymes? And then A is 2, B is 5, C is 6, and D 7.
D. 7.
7. All right. So 7 is pointing to the pancreas, right? So the pancreas added. So that's good. So these are some of the questions that the way they ask some of the questions based on the diagram, right? So it's good to know what each of them do, so that when they ask you, you can easily. That's why I put in this diagram here, so that you can at least study and know what each one produces. Okay. Okay. So I think this covers the endocrine system. All right, just one more on the endocrine system in the stomach, right? Let's look at the stomach here. The stomach also produces some hormones, which we'll talk about when we talk about digestion. It have like gastrin, it produces some amount of histamine and somatostatin and neuropeptide Y, right? So some of them mediate pain, like histamine and allergic reactions, histamine, for example. And a gastrin leads to causing the release of the HCl, hydrochloric acid, in the stomach. So we'll be talking about digestion shortly. Great. All right, so I believe we have more than enough to be able to answer questions on the endocrine system, right? It's very packed. The endocrine system can take you several days of lectures if you have to treat it in detail. Just taking the thyroid alone can take you a whole month even to talk about it.
Professor, I have a
Yes, have a question?
yeah, I have a question about the last class, the physics part for the circuit. Like the question will be like what kind of circuit, like in the diagram it's showing. So we'll have to answer about the circuit, like it's parallel or series, or we'll have some math about those kind of circuits.
I don't think they're going to ask any like math per se on those circuits, but there's one particular question. Usually I ask that during the when we take our last test, like the last exam, that it comes up. It's more like application. Okay, I'll show you. It goes like this. It's just a simple application. Okay, before we come to the digestive system, that one goes like, okay, there's something called effective. They don't even ask you the calculation, but let me mention here, effective resistance. Okay, so if I have something like a series circuit like this, Okay. And the resistance here, let's say this is 2 ohms, right? Remember, ohms is a unit for resistance. And let's say I have 5 ohms here.
Yes.
Okay. Like the way we did the forces where they ask you net force, right? Or effective force. It's very similar. So here we ask you what is the effective resistance or the net resistance. When you have series, you add them up, like the total resistance in the circuit.
Yeah.
So effective or the net resistance, when they are in series, you add up.
2 plus 5.
So it becomes 7 ohms. So that's a series. You remember this series. Okay, you add them up, right? So it adds up. The more you connect, more resistors, or the total resistance will add up. Okay, that's in series.
Yes.
But when you come to the parallel, man, I don't know, today the system is freezing up. It's not allowing my pen to work too well. Okay. It's not allowing my pen to work too well today. Give me a second. Let me see. Okay, it's back. It's still not back. So, yeah, I want to give an example on the parallel one for the same thing. So, okay, all right, so parallel. So for parallel one, let me connect this in parallel. That'll look like this. So we'll do it for the same resistance. Let's say this 2 ohms, and this is 5 ohms. If they are connected in parallel. Now, if they are connected in parallel, you don't add up the resistances like we did before. You add this, what you do. You add the reciprocal of the resistances. So the effective resistance is given by 1/2 plus 1/. Let me write this out very well. Okay. Okay, so to find effective resistance, this is what you do. I'm going to give a general expression first, and then we'll put this in. So if I have a general one like this, let's say this is R1 and call this R2. So the effective resistance we'll use 1/R, where R is the resistance, effective resistance is equal to 1/R1 plus 1/R2. You do this, and when you finish, then you take the reciprocal of your answer again, and then that will give you the effective resistance. So we're going to do 1/R, which is a resistance, is 1/2 plus 1/5. You have to do this. They do the LCD. So 1/R is equal to, so LCD will be 10, right? So it's 2, that's 5/10 here. plus this is 10, and that should be 2. So we have 7/10. So the resistance, we have 1/r is equal to 1/10, right? This is what we have so far. So to find r, we take the reciprocal of both sides. So r will be 10/7. So this will be your
Answers.
your effective resistance, 10/7. If you can work in decimal, 1 point something. Okay. So that's how you find when they are in parallel. You add up the reciprocals, then when you finish, take the reciprocal again to get the r, to find the. So if you look here, the resistance for the parallel for the same resistances is smaller. Okay, this one about 1 point something, and here when they are in series, it's 7. So parallel gives you a lower resistance than when you connect them in the same resistance in series. All right. So you could have something like this. I mean, they hardly ask anything like this, but the question that they ask is they draw a common question, which usually I ask. They would maybe give you this, the same thing that we have there, maybe 2, 5 ohms here, ohms there, and then give another one, 2 ohms, 5 ohms, and probably one more of this. Maybe 2 here, 2 there, and probably 5 there, like this. Okay. And then may ask you which one draws more power, or which one will draw less power. It's a question like that. So you have to apply your knowledge that if you connect them in series, you have more resistance, right? So the one that will draw less power is going to be this one, will draw less power because the resistance over the parallel is lower. So it's going to draw less power. While this one will draw more power because the resistance is higher. So it is going to draw more power here, okay? Because remember, we define power as I squared R. If you remember last week, I squared R, or P is equal to VI, if you remember. So the power depends on the resistance. So the higher the resistance, the more power it's going to draw, and so on. Okay, so that's one application of what I just described.
Professor, the last one you draw,
Yes.
like this one also series, right? The last one?
This one,
The last one.
the P is equal to VI.
No, the 2 ohm, and then 5 ohm.
Yes.
Resistor. It's the series.
Yeah, that's series.
Okay.
That's series, yeah. Remember, series is only one path, right? If you block it, nothing will flow, current will not flow.
So, okay.
Yes. Okay, good. So that's a good question. All right. So I mean, we'll see some other questions. Usually they ask you to like power as a common question that they ask, like the power, and then find a voltage. They give you one of these things. You have to find maybe resistance or find based on the formula here. That's a common type of problem. Okay. All right, good. All right, so let's look at digestion. So I put in something I did in the past, diagram of the digestive system over here. Okay. So the digestive system, as we know, has the pharynx. We start the pharynx in the mouth, then esophagus, the stomach, the small intestines, the large intestine, and then we talk about pancreas, the gallbladder, and the liver. Those are things I want to look at. All right. So let's begin with the the mouth. Digestion begins in the mouth, all right? So you eat the food and then you chew it. You chew it up. So that's mechanical digestion, what we call a mechanical digestion, okay? So the food is digested, right? The teeth, mechanical digestion, and then it mixes up with the saliva. That's where the chemical digestion starts, right? So the key thing I want you to remember here is the fact that amylase, the enzyme amylase, you have amylase in the mouth, which breaks down starch to sugar, amylase, very important. Remember amylase. So the amylase breaks down starch to sugar. Enzyme in the saliva. That breaks down starch to sugar. So remember the question where they ask you, someone chews crackers slowly and becomes sweet, right? So what's happening there is the amylase in the saliva breaks down the starch in the crackers and into sugar. That makes it sweet. Okay. And then once the food is mixed with the saliva, it forms what we call the bolus. So you form the bolus in the mouth. So bolus formed in the mouth, right? So the bolus is the food, the mechanically broken food down, food that is rolled into a ball in the mouth. And then the food goes down the esophagus by the process known as peristalsis. So remember the key word peristalsis. So we're talking about the esophagus now, over here. So esophagus, the tube leading down from the pharynx to the stomach. So bolus that's a food blob. It's pushed down by muscles that contract in the esophagus, known as peristalsis. So peristalsis. So remember, key word in the esophagus. Peristalsis. Okay, so it's the rhythmic contraction and relaxation of the muscles, circular muscles, to push down the food, you know. And as it pushes down, it also helps in mechanical, breakdown of the food as well. And remember, food doesn't go into the trachea. The trachea is right behind the esophagus here. They have a common opening into the pharynx. By the food that is prevented from going to the trachea by the flap known as the epiglottis, right, in the mouth. So once the food gets into the stomach, very important for us to look at the stomach. Down in the stomach, you also still have what we call mechanical digestion. The muscles of the stomach, they also contract and help to break down the food further. And then we also have the chemical digestion. So the chemical digestion in the stomach, that's where the acid and the enzymes will come in, right? So you have the hydrochloric acid, right here. The hydrochloric acid, it kills bacteria in our food, and you also have the hydrochloric acid that stimulates the enzyme called pepsin. Pepsin is also released in the stomach. It comes in the form of the inactive form called pepsinogen. You have pepsinogen. So stomach, when remember the acid HCl, that's hydrochloric acid. Hydrochloric acid. Another function of it, as I said, helps to stimulate the enzyme called pepsinogen. anything with O gene attached to it is an inactive form. O gene, right? So it's inactive. So it is inactive enzyme. But then with the hydrochloric acid, HCl, it becomes the active form known as pepsin. This is the active enzyme called pepsin. And the function of pepsin is to digest proteins. So we have protein digestion. It's going to start in the stomach. So here, digestion of protein. Pepsin will digest the protein. So digest protein. Okay. Right. There are some other enzymes in the stomach as well, like lipase. Lipase enzyme that breaks down lipids somewhere also in the stomach. But the bulk is like protein digestion. And they have bicarbonate. They also produce bicarbonate, sodium bicarbonate that also neutralizes the gastric acid as well. Okay. The acid does not digest the stomach because of the presence of mucus. You have mucus also produced in the stomach, mucus. Okay. And we have gastric juice. The stomach produces a lot of juices. So the gastric juice mixes up with the food to form what's called the chyme, CHYME here. It's a mixture of the food with the gastric juice, right? Then the food will be released to the first part of the small intestine, which we call the duodenum, right? The small intestine. So the small intestine has 3 parts. Small intestine. First part is the duodenum. Second part is the jejunum. And the third part is the ileum. The ileum, all right? So many things occur in the duodenal part. In the duodenum, this is where you have the bile is released here. Bile released in here. Okay. The bile duct opens into the duodenum, right? And then you also have the pancreas, also releases here. So okay. So important thing that occurs in the duodenum is digestion of fat. Digestion of fat occurs in the duodenum because of the bile. Bile plays a role in what we call fat digestion. What the bile does is that it emulsifies fat. So here you have fat digestion occurs in the duodenum. Okay, I'll talk about the bile duct, the gallbladder shortly. Okay, and then in the jejunum, digestion continues. And then once you come to the ileum, this is where you have the ileum and jejunum, a lot of reabsorption. Of the digested food occurs in the ileum. Okay, in the ileum you have what we call the villi. That's another common question. If you cut across the ileum, you see some finger-like projections on the surface. Those finger-like projections are known as the villi. Singular is villus. Okay, so plural, villi. Okay. The function of the villi is to increase the surface area for digestion. So the villi, very important to remember this one, increases the surface area for absorption. Okay, so if you think about it, the towel, the threads that stand out in the towel, right, it looks like villi. You know, the threads increase the surface area so the absorption can take place easily, right? Because each one is surface. If you look at the surface, all this absorption can occur along all this here, the surface here, instead of just being flat. So you have so many cells packed into a small area for absorption. So remember this function very well. It's a common question. Okay, the villi. Okay, so once you know that, we can now move on to the liver and then the gallbladder. So the liver has so many functions, but let's narrow down to these ones. It produces bile, right? That's where the bile is produced. The bile is produced in the liver. And then it is stored in the gallbladder. So that is this. The gallbladder is somewhere here. Okay. So bile produced in the liver, stored in the gallbladder. Remember that portion. Okay. So the gallbladder is just for storage of the bile. It also filters blood and breaks down used red blood cells. Okay. It also regulates the amount of glycogen in the body. So it stores excess glucose in the form of glycogen. So if you need glucose, your liver can break down the glycogen stored and release it into the blood and so on. Or it can store if you have too much glucose in the body. So it works with the estrogen, sorry, it works with the insulin and glucagon, right? It works with those hormones. Then the gallbladder, as I said, stores the bile, right? Bile is like greenish, yellowish, greenish color, you know. And the function of the bile is to emulsify fat. So let's write that word down, to emulsify fat. So when I say emulsify fat, this is what we mean by emulsification of fat. So the gallbladder emulsifies fat. Bladder, so the bile emulsifies. Okay, so when I say emulsification of fat, it means that it helps to break down the fat into small droplets. You know, fat doesn't mix in water, but the bile helps the fat to mix up with the water by breaking into small droplets. So it's acting like a soap, like the way soap acts. If you use soap and you can wash any oily substance in water, that's how the bile works, and that's what we call the emulsification of fat. Okay, so if somebody's not producing enough bile, if the gallbladder is removed, then the person will have difficulty digestion to digest fat, Okay, so they emulsify. So it helps to break down fat into small droplets. Okay, so that's one. And then two, if somebody is not producing bile, or the bile, there's a problem with gallbladder, which happens a lot, gallbladder problems. So sometimes it ends up being removed in what we call cholecystectomy. They will have problem digesting fat. In addition to that, they would have difficulty absorbing the following vitamins, the fat-soluble vitamins. We have 4 of them: A, D, vitamin A, D, E, K, ADEK. The fat-soluble vitamins. Vitamin A, D, E, and K. We call it a fat-soluble. So the bile helps to absorb this. Needed for the absorption of the fat-soluble vitamins. So if we take out the bile, then there'll be problem with absorbing these as well, and difficulty emulsifying or digestion to digest the fat. Okay. All right, so that should be good for the bile. So if you look here, how gallstones are formed due to too much cholesterol. Cholesterol is also needed for bile formation. So if you have too much of that, you can have gallstones in the bile. It hardens, and it can block the duct that goes that the bile goes through into the duodenum. Severe pain can cause severe pain. So sometimes the gallbladder, the stone has removed. Sometimes even the gallbladder itself may have to be removed. So that is the function of the bile here. And then the pancreas. The pancreas releases pancreatic juices, right? Pancreatic juices. So now we talk about the exocrine function of the pancreas. So release pancreatic juices that mix up with the chyme that has been released into the duodenum, right? The pancreas also releases other enzymes. So if you get there, all the different enzymes that are needed for digestion of lipid, fat, and proteins, they're all released there. They all continue the digestion of all those things. So pancreas is very important. So let's say that all the enzymes, so you have lipase present there, you have amylase, And then you have proteases that digest proteins and so on. They're all present. So digestion continues for all the substances. And then, as I said, you have pancreatic juice also added to the chyme over there. Okay. It also produces bicarbonate, sodium bicarbonate, that neutralizes the acid that is released into the duodenum. Okay. So those are the functions of the pancreas, the exocrine functions of the pancreas in digestion, right? Right. So I think we've talked about everything here. Now the large intestine. When it comes to the large intestine, the main function of the large intestine is to absorb water and also to eliminate waste. So absorption of water and elimination of waste here. So it stores the waste product as feces, right? That's what happens in large intestine. So the large intestine has three parts. You have the ascending, which is here ascending. They have transverse, and then you have the descending portion. Okay. And here it's called a sigmoid colon. For those anatomy physiology, they have the rectum and then the anus here. All right. Okay. So those are the general things about the digestive system. The appendix usually has no particular function, as it's of no use. It's not necessary, but it plays a role in the immune system. They call it lymphoid. It's a lymphoid organ, okay. But basically it has no main use. It just causes problems, you know. Okay. All right. So this is a summary of all that I've said. If we get it. So you can read that when you get a chance. Okay, all that I've said is here. Okay, good. All right, so any question on the digestive system? Questions on the digestive system? All right, so please read the summary that I have here. The 10 points that's going to help you get a good overview of the digestive system. Okay. All right, great. If there are no questions, let's move on to this so that we can finish and answer questions. Overview of the genito-urinary system. So the genito-urinary system consists of the kidneys. The kidneys here. Then you have the ureter, the two of them here. They carry the urine, the ureter. And they have the bladder that stores the urine or collects the urine, stores it. And then you have a urethra that comes out. Right? So that's an overview of the genito-urinary system. Now, the main organ involved in urine production is the nephron. So the basic unit of the genito-urinary system is the nephron. Okay. So I have the diagram of the nephron here. The nephron. So the nephron has different parts. So let's go through the parts. Now this part here is known as the glomerulus. So you have, let me draw that first here. So you have the nephron will look like this. As you can see, a part that goes up and down like this, they have a loop. And they have this part here. And then that's how it looks like, as you can see. Okay. So this part here is called the Bowman's capsule. Bowman's capsule. And this portion that goes up and down is called the proximal convoluted tubule. And this part here also goes like up and down, wavy. This part is called the distal convoluted tubule. Distal convoluted tubule. And then this is known as a collecting duct. And then this hairpin loop here is known as the loop of Henle. Okay. So there's blood vessels that come in. Blood vessels come in like this. So that's going to come in here. Now they break out into capillaries, and then it comes out. Okay. Now this is what called a glomerulus. So this is the glomerulus. So this is a glomerulus. Glomerulus. Okay. And then the vessel here is known as the efferent vessel. Okay. And then the one that goes out is the efferent vessel. Okay. So that is a description of the nephron. So what I've described is a nephron. That's a nephron. Okay. The basic unit of the genito-urinary system, right? So what happens in these portions? So let's go through the diagram here. Okay. So in the glomerulus has the tiny holes in there. So the first part in urine production is what we call filtration. Filtration is going to occur within the glomerulus. So the blood is filtered and the filtrate collects in the Bowman's capsule, right? Bowman's capsule. So urine production, let's put down the urine production here. Urine production, 3 key steps. 1, you have filtration. 2, you have what we call reabsorption. And 3, you have what we call secretion. So these are the 3 key points that come up on the test. Okay. Urine production, filtration, reabsorption, and secretion. All right. So let's go back to the diagram and see where these occur. So as I said, filtration occurs in the Bowman capsule here. The blood comes in through the efferent vessel or arteriole, and it pushes out. There's high pressure here that forces the liquid part of the blood, which is plasma, out into a Bowman's capsule. Remember, the plasma contains dissolved substances like glucose, salts and other things, right? So as it passes through the proximal convoluted tubule, you have reabsorption occurring right here. Okay, so see proximal convoluted tubule, reabsorption of water, ions, and all organic nutrients occur here. All right. So the filtrate then flows through and gets into the distal that we call descending loop of the loop of Henle. You have the descending and ascending loop, right? So as it descends, what happens around this area? There's a complex mechanism that occurs here, where sodium is pushed out. During the descending part, salt will push out here. So that the blue part is like a salt being pushed out. Okay. So as sodium is pushed out here, it means the filtrate becomes more concentrated as you move down the loops. No, sorry, it becomes less concentrated because you're getting out the sodium. It becomes less concentrated as you move down this loop of Henle. And as it ascends here, water is then moved out because the whole tissue around this becomes concentrated with the sodium, right? High sodium concentration around the tissue because it's pushed into the tissue around here. So that causes the water to be drawn. Water always follows sodium back into the tissue. So this is known as what we call the counter current mechanism around here. Okay. So over here, see the further reabsorption of water occurs in the descending limb, and both sodium and chloride ions in the ascending limb. So that's a summary that you have here. Sodium out here, water is absorbed around here. Okay. So whatever is left flows up, gets to the distal convoluted tubule, and then the distal convoluted tubule, you have what we call secretion of ions and acids, drugs, and other toxins. They're released into the filtrate that is produced here, so or the urine that is being produced, right? You know, it controls the amount of ions and acid that are being lost. And this is where the mineralocorticoids act, like the aldosterone. So if somebody has too much sodium, a lot of sodium will be released. If you have less sodium, you absorb and so on. Same with potassium and chlorine and other things. They're all released around here, you know. So that's where concentration of the urine occurs, you know. Then whatever is left flows through the collecting ducts, and then it goes into the ureters to be stored in the bladder. Okay, so this is an overview of how urine is produced. So remember the three concepts: filtration, reabsorption, and then the secretion. Three main things. Okay. There's a question that will ask you, like, which of the following consists of all three? You know, there's a question like that. So I believe we'll see it as we go through the questions. Okay. All right, so that should be good for urine production. Any questions, but I'll move on to the next one, urine production. Okay.
Thank you.
I believe so far so good. Okay. Okay, good. We're making good progress. All right, so let's move on to the blood. We did this last week, so I'll not waste time on this particular one, but just a quick overview what we discussed last week on the blood. It is more visual. Okay. We spoke about the three types of blood: red blood cells, platelets, and the white blood cells. This is how they look like. The different types. Neutrophils, also known as the polynuclear. They say they are polynuclear cells. The nucleus is like lobed, like this one, you know. Okay, so that is that, and we spoke about, we did that in detail. So that's a summary of what we did last week on the blood. All right, so let's look at the cardiovascular system, the cardiovascular system. So the cardiovascular system, usually when I'm discussing this, I like to use like a box to show you a summary of it. So this consists of the heart, which has 4 chambers. On the left side, you have the left atrium. They have the right ventricle, left atrium, and then the left ventricle. And then on the right side, you have the right atrium, and then the right ventricle right there. Okay, those are the 4 chambers of the heart. And we have what we call the systemic circulation. Blood goes from the heart to the body and back to the right side of the heart. That's the systemic circulation right here. Then the pulmonary circulation from the right part of the heart goes to the lung, and then from the lung back to the heart. So that's a pulmonary circulation. Okay. So remember that blood that comes from the lower part of the body, there's the blue one here. The blue part represents deoxygenated blood, right? Blood without oxygen in it. Deoxygenated blood. Now the blood flows into the right side of the heart, the right atrium, right here, through the vessel called the inferior vena cava. Remember, I hope you remember the inferior vena cava. And then from the head region, blood comes into the right side through what we call the superior vena cava. Superior vena cava. I want to draw the box form that I'm talking about for you. It's going to help you in your nursing class. So I use a box like this. So that's the left ventricle, left atrium here, left ventricle, right atrium, and that's the right ventricle. Then the lung is here. Okay. So as I said, blood comes from different parts of the body. To the right side, the right ventricle, the right auricle here, or the right atrium, rather. That's the word atrium. The right atrium, and this is known as the inferior vena cava. Okay, so that's inferior vena cava. And then from the head region, the blood comes in to the right atrium. So this is superior vena cava, and then lower part is inferior vena cava. Okay. So these are carrying deoxygenated blood. Okay, on the right side. Okay, so the blood comes in from here, goes in there, from head region goes in. Okay, then the blood flows through. There's a valve here, which is the tricuspid valve, right? Tricuspid valve is here. Tricuspid valve. So it prevents the backflow of blood from the atrium, the right ventricle into the right atrium, right? So the blood flows in here and the blood comes out through another vessel that goes to the lung, which is the blue one shown here. And so this is the pulmonary artery. Pulmonary artery. So remember the pulmonary artery carries blood to the lung. Okay. So it's an exception here. All arteries carry oxygenated blood except the pulmonary artery. Very important for multiple choice questions. Whether you're doing anatomy, physiology, most teachers will ask that question. So all arteries carry oxygenated blood except the pulmonary artery. So that's an exception to the rule. Okay, that you have to know. Okay, all right. So once the blood goes into the lung, then you have oxygen added to it, becomes oxygenated. And once it's oxygenated, so that's a lung, the blood flows through another vessel that brings the blood to the left part of the heart, which is the left atrium. So this vessel here is known as a pulmonary vein. That's also an exception to the rule. All veins carry deoxygenated blood except the pulmonary vein. Here, exception. So this is carrying oxygenated blood here. So on the left side, you have oxygenated blood. Because the blood, oxygen has been added to it in the lung. Okay. So exception is here. All veins carry deoxygenated blood except the pulmonary vein. So that's an exception to the rule. Okay, so good to know that too. Okay, so once the blood gets here, there's a valve in here known as the bicuspid valve. Okay, so it has two leaflets. Tricuspid has 3 leaflets or cusp, or called a cusp, right? So the blood flows through the bicuspid valve into the left ventricle, and then left ventricle pump the blood through the largest artery in the body, known as the aorta. Okay, to different parts of the body, all parts. Okay, very good. So this is what is happening. So that's deoxygenated blood. Okay, all right. So this diagram, if the box diagram can help you a lot when you're doing your clinical practice, pathophysiology. Okay. You can use it to predict what's going to happen when someone has heart failure, right? You can have heart failure, that either the left heart or the heart can fail, or the right heart side of the heart can fail. When the left heart of the fails, we call it left heart failure. and the right heart is right heart failure, right? Any of the chambers can fail. What's going to happen if the left heart fails? If the left side of the heart fails, that means that blood that is coming in, see the blood is coming in here, cannot go out. So if it cannot go out, what's going to happen? That means that there's what we call pooling of blood. So the blood will stay in here, pooling of blood backwards, like, into the lung. So you have fluid in the lung. The person will experiencing like difficulty in breathing, and they'll be coughing out what we call pink, frothy sputum, like foamy sputum. And it's pinkish because some vessels are ruptured in the lungs. So if you see that in your clinical practice, they know that the person is having left heart failure. And when you listen with a stethoscope, the person will have fluid. You feel what we call crackles. You hear those sound like in the lungs, called crackles. Okay, they know the person has right heart failure. Sorry, left heart failure. Okay, so fluid in the lung. Now, if this is not treated, then you're going to have the pulling of blood backwards. Then the right side will also be affected. So it's going to affect the right side because they are connected, right? If the right side is affected, what's going to happen? There'll be the blood coming in cannot be pumped out. So there's pulling of blood backwards, back into the tissue, into the lower part of the body, and so on. So you have swelling of the legs, like a lower extremities. It starts with lower extremities, the legs. You have fluid in the legs. If this is not treated, then you have fluid in the tummy, in the abdomen, abdominal area, and so on. So you see fluid in the abdominal area, they know the person also has in the leg, abdomen, and so on. Then you have right heart failure. Okay. If the person has fluid in the lung, as well as swollen legs and fluid in the abdomen, then you have combined heart failure when both hearts, both chambers of the heart has failed, and so on. So you can use this to predict a lot of things that happen in clinical practice. That's why I like to always draw this for people to see. Okay. All right. So this should be good for questions on the cardiovascular system. Any questions? Pause for a second for questions. Okay. Everybody good to go? All right. Okay, good. So that brings us to the end of what I want to talk about on the science lecture today. We'll move on to answer some few questions. And to do that, I want us to look at how to analyze data. How to analyze data. They ask a lot of questions on analysis of data. For this part of the test, you don't have to have any knowledge on whatever is being asked. It's more like comprehension, understanding what they're asking you, and then you can answer from the text. Whatever, the answers are always within the question, if you read it carefully. So don't get scared when you see long statements, long passages in the science, and they ask you a question. They are just, the answers are all within the question. You just have to take your time to analyze. So how do you analyze data? 3 areas to focus on: data analysis, interpretation of graphs and pictograms. They give graphs, you just analyze the graphs. And then you should also analyze and make conclusions, right? You have to make conclusions from whatever statement that is given to you, all right? So you should know how to come up with hypothesis when you are given a question. Hypothesis is just like a good guess, a good intellectual guess, or statement that you can make about something occurring. If it is proved enough, like if you prove it through experimentation, then you end up with what called the theorem. All right, you can make a theorem based on your observation. Now, if the theory is proved several times and it's found to be true, then it becomes what we call a law, right? Law. So it means law is like a theory that has been proved and found to be true. Like a law of gravity. It's found to be true. Throw something up, it always comes down. So that is a law. Okay. All right, it's good. Then you should know about experimental groups, what we call the control group, and then the experimental group. Experimental group, that's the group that receives the treatment or the independent variable. So if I want to test for something, those that you administer the test to will be the experimental group. And the control group that serves as a standard of comparison or a constant. The independent variable is either not present or set at a standard value, right? And I have an example here. Plants that, let's say, want to test whether fertilizer is good for plants. So you have two groups. One plant that you give them the fertilizer, and then that will be the experimental group. And then the other group, you just don't give them anything, no fertilizer. Then you see the effect, which one is going to grow better. You compare the two, and then you make your hypothesis from there. You make your, what do you call it, your conclusion from what you observe. Okay. So let's say for the pre-nln or the NLN exam, to see whether, let's say, the workshop or the class is effective, I can do experiment, two groups. One group, give them the workshop, then they take the test. Another group, no workshop, then give them the same test and see which group performs better. So the group that gets the workshop will be those who form the experimental group. Those who are not exposed to the workshop will be the control group. Okay, so they ask questions like this, and you have to state this experimental group or control group and so on. Okay. So that a quick overview of what we want to deal with today. Okay. All right. So now let's go to the textbook, and then we will go through some of the questions to illustrate what we've done today. So today we made a very good time. So we would go through a lot of questions. I may go back to some of the things we did last week. If I see a question that we didn't do, we'll still do them today as well. All right, so pull out your textbook and let's go through some problems. Now, the first one we'll look at will be on page 218. 218. Number 5. It says that the alimentary canal is also associated with the A, spinal cord, B, digestive system, C, urinary tract, and D, birth canal.
B.
D, correct, digestive tract or system. That's another name for alimentary canal. Okay, good, correct. Number 6, the numerous villi in the small intestine serve to A, secrete enzymes for digestion, B, absorb water from dissolved food, C, secrete hydrochloric acid to dissolve food, and D, provide greater surface for absorption.
D.
D, correct, because the function of villi is to increase the surface area for absorption, correct. All right. All right, now let's look at the diagram for number 9. And you see how easy it is to answer diagrams. Don't skip diagrams and experiment. As I said, the answers are always in the question. All right, so number 9. So it's a diagram, it's a graph, right? So look at the graph. You have emission and fuel ratio on the y-axis emissions, and then the x-axis air fuel ratio. So it says, number 9 says, the exhaust from the engine contains the most nitrogen oxide when the air fuel ratio is approximately 12:1, 16:1, 18:1, 20:1.
B. 16:1.
Yeah, 16:1. Correct. So if you look at it, you trace the graph for the nitrogen oxide, right? And then you see where the line is. Just a little bit beyond that, you have 16:1. So that's correct. Number 10, it says this graph provides an explanation of A, engine knock, B, lead content of gasoline, C, diesel engine operation, and D, air pollution.
D.
D.
D, air pollution. Okay, so why do you say air pollution? Any reason why you say air pollution from the experiment or the diagram? Any reason? If you look at the x or the y-axis.
Professor, the nitrogen oxide is the major cause of the air pollution, right? Because of this reason, it can be the air pollution.
You say it again.
I think the nitrogen oxide may be the major cause for the air pollution.
Yeah, for this one here. Yeah, so the keyword is emission, right? The emissions, that's what gives the answer out. You're doing like emission gases released into the air. Okay, that's why you look at air pollution in this particular one. Okay, all right, great. So number 11, the emission of carbon dioxide is probably not included in the graph because carbon dioxide is A, included in the hydrocarbons, B, not affected by the air fuel ratio, C, natural part of the atmosphere, and then D, part of the carbon monoxide. So what do you think?
B.
B, yes, it's probably not affected by the air fuel ratio. That's why they didn't include it in this. All right, so that's a good explanation here why they didn't include it. Good. So you see all this, you don't have to have any particular knowledge. You're focusing on the diagram. Always focus on the diagram. See, this type of experiments, we're going to see some experiments. Don't try to bring in your other knowledge, like outside knowledge. Focus on what they're asking you, whatever the question says, the comprehension. So you got to focus on the particular statement that are made within the question. Otherwise, you're going to get them wrong if you try to bring something which is not in there for your, let's say, your own mind. All right, good. All right, let's see another one here. Okay, let's go. Page 222, 222. It's an experiment. So take a minute to read the experiment and then we'll answer the questions.
What
23.
number is it?
We are working on 23, 24, 25. '23, 24, 25. All right, so I'm going to read it. It says a chemical test for the presence of dissolved vitamin C is that the vitamin C bleaches a dark blue solution of indole phenol. A student placed 1 ml of indole phenol in each of 6 different test tubes. Then the student added a different liquid, drop by drop, to each test tube until the blue color of the indole phenol disappeared. As indicated in the following table, Each liquid took a different number of drops to bleach out the blue color of the endophenol. And then they gave you the liquid and then the drops. Lemon juice, 5 drops. Fresh orange juice, 20 drops. Cooked orange juice, 30 drops. Pineapple juice, 30 drops. Apple juice, 45 drops. And water, 100 drops. Did not bleach it. Okay. So question 23. Say, which liquid had the highest concentration of vitamin C? So which one has a high concentration? A, fresh orange juice. B, water. C, lemon juice. And D, apple juice.
C. Lemon juice.
Lemon juice. Okay, so what's your reason for choosing that? Why lemon juice? What's the reason? Yeah, you are correct. But what made you choose that one? Anybody? Why do you say? Why do you think lemon juice is correct?
Since it's more on the sour side, I would say orange juice is a bit sweet, so I don't think it would contain, I don't know, much vitamin C as much as lemon.
Okay.
I think
Yeah, but focus on the drops.
Yeah.
Focus on the drops.
So, okay, less drops means it's more
Yeah, you see, you need just a small amount to change the color. The
concentrated.
endophenol change color. So it's concentrated in there, right? Think of like Tide, like compare Tide soap to the other detergent to the other detergents. Usually you use a little bit of Tide and then it does better work than some of the other ones, for small amounts, but it has very effective. So it means that it's concentrated. Okay. All right, so 5 drops. So that's why the lemon juice. Then 24, according to these results, when orange juice is heated, its concentration of vitamin C is A, increased,
Reduce.
B, reduced, C, destroyed, D, maintained at the same level.
B.
So reduce, yeah, B, correct.
Reduce.
Right. If you look at the drops, cooked orange juice, you have 30 drops. Before, if it's the fresh one, you have 20 drops. All right, so small amounts changes, but now when you cook it, you need more. So it means that it's less concentrated. Okay, good. So it's reduced. And then 25, which of the following substances contain no vitamin C when the study began? So no vitamin C. So A, endophenol solution. B, cooked orange juice. C, lemon juice. And then D, apple juice.
A.
A, the endophenol, right? The endophenol is the indicator that you're going to use. So it should not contain any vitamin C to begin with. All right, correct. And so you see this experiment, again, you don't have to have seen the experiment before, but if you think through it, we can score easily, Okay, look at 26. 26, it's a diagram, it's a giveaway. For that one, if somebody gets it wrong, then there's a problem, right? For 26. You said, in which month does the longest shadow occur? So which one gives the longest? If you're not too sure and your eye is deceiving you, put a paper or your pen across so that you don't miss the heights. So A is A, B is G, C is K, and D is M. Which one is a longest shadow? Yeah, A is the tallest amongst all those things given. So this one is like a giveaway, All right, good. So far, 29, 31, we did that already, the diagram, endocrine system. So jump that. Okay. Now page 224. Page 224. Number 32. So let's look at number 32. So for 32, it says a reading on a social scale is 5. On the Fahrenheit scale, the reading will be closest to A 225, B 30, C 40, and then D 95.
D 40.
40 degrees. Okay. Okay. So here it means you have to remember the formula, right, for changing Celsius to Fahrenheit or Fahrenheit to Celsius. So F is equal to what? 9/5 C plus 32. So that's how you change Fahrenheit, Celsius to Fahrenheit. Okay. So you give me your Celsius. So your F will be equal to 9/5 times C is given as 5. And then plus your 32. You can cross out the 5, cross out. So you have F is equal to 9 plus 32. And that gives us 41 degrees Fahrenheit. Okay. So it's a closest to. So we go with C, which is a 40. Okay. All right. So good to have this formula down. Okay. Great. All right, let's look at 34. If a car's if a car's rate of change of velocity is negative, then the car is A, speeding up, B, maintaining a constant speed, C, slowing down, and then D, stopped.
C, slow down.
Yeah, slowing down. We saw this last week when we drew the graph, like positive slope, then horizontal line, and then negative slope. The zero slope here, right? Velocity against time. So acceleration, no acceleration, and then deceleration. That's what we discussed last. So it's slowing down, negative slope here. Okay, great. For 35, balancing equations, as I said, you should also be good at balancing equations. So see if you can figure that out. Okay, what do you get for that one? N2 plus something here, giving you NH3. Okay. So you want to balance this equation. So what is the coefficient of ammonia in the balance equation that has the smallest whole number coefficients?
2. 2 and 2.
2. Okay, all right, let's see. So you have
What page you on?
page 224.
What
224.
number?
35. So here you have 2. If I put 2 here, so I have 2n, all right? So this is 1. That's what that means. And this is 2 and 2 here. So this should be 3. Okay, so it's balanced. Okay, good. So the answer is 2B, correct. So we want this one. Okay, great. All right, so another experiment question. 36, 37, 38, based on the diagram. So take a minute to look at it. So it's a graph. It says, so the question 36 through 38 refer to the following graph of changes in the population over a time period. The graph represents the relationship of the actual population to the capacity of the environment to support it. All right. So the question is, at which point is the population growth most rapid? For 36. A, I, B, I, C, I, and then D, IV.
B, I.
B.
Okay, so most rapid. I. So B,
No.
correct.
B2.
Yeah, you're right. Most rapid, because if you look at the graph, that's the steepest slope, right? You look at the slope, that's what they're trying to ask you. It goes like this, and then you have this, right? Flat. And then the other one, it's a little bit slanting like that, a little slant, and then goes up and down. Okay,
Professor,
so yes.
I have a question about number 35, the unbalanced equation.
Okay.
So if I give like the 2n2 plus 6h2, and over if I give 4nh3, I will be wrong in the
Yeah,
exam.
it said the smallest.
No, I am talking about the unbalanced equation. 35, number 35.
Yeah.
So if I give the first one 2n2 plus 6h2 equal equation, and then I give 4nh3, I will be wrong in the exam.
Yeah, because you see that if you read the question, let's go back to that question. It says, what's the coefficient of ammonia in the balance equation that has the smallest whole number coefficient? Yours is high. You see, yours is 2 times what we have. But you want the smallest coefficient.
Oh, okay.
Yeah, the smallest.
Professor, I
Yeah.
am thinking about the equation. Okay, then it's
Yeah, you always want to use the smallest.
okay.
Yeah, correct. Good. Yeah.
Thank you, Professor. Thank you.
You're welcome. Hey. All right, right. So this, as you said, so this one, 36 is B. This part is the steepest. Like, a lot of people end up choosing this part, which is not correct, but this is the steepest part. So this rising faster. So that's why B is correct. Okay, so 37, he said, at which point is there a decrease in population due to competition for a dwindling food supply? So where do you think there's competition? Competition.
Is D, IV.
IV. Okay, so IV, this is IV here. So that it's going down, dropping, right? So it's decreasing, population is decreasing here. Got this competition, right? And then 38. For which type of organism is this graph believed to be typical? A, bacteria only. B, plants only. C, all animals except humans. And then D, all organisms including humans.
D.
Yeah, D, correct. All organisms including humans, right? So all organisms go through this. If we put like bacteria in the petri dish, the culture, the same thing. Initially, if you have just food here, the bacteria, this a few bacteria here, because of enough food supply, they'll grow fast growth. So that's a growth here. Now, after some time, when all the food has been used up, right, they grow, then they end up dying. There will be death rates occurring. So the population, first the population comes to, the change will be the same. The rate of death will equal to the rate of reproduction, like a stable population. Then after some time, if the food goes down, then they'll begin to die. And then that gives you this part here. It's good. The same thing is going to happen with any organism if you have the limited food supply. All right. So the only reason why it doesn't happen to us is because we all keep on producing food. In order that if you put us in the same room and the food supply, there's nothing going in and going out, we'll all go through the same scenario. So D is correct. Perfect. So again, You don't need too much knowledge to answer this type of question. All right, another experiment. Questions 43 and 44. That's page 225, the same page we are looking at. 225, 43 and 44. So read the experiments and then answer those two questions.
What number is it?
43 and 44. 43, 44.
I am done.
Done. Okay, so I'm going to read through. So a student was testing the colored materials in spinach. He ground up some spinach leaves in acetone. He then filtered the mixture and obtained a dark green filtrate. He placed a spot of this filtrate on spot X on a strip of filter paper. Then he hung the dried paper in a tube containing a mixture of petroleum ether and acetone at the bottom. After a while, he observed moisture creeping up on the paper and several bands of yellow and green color. All right. So the question says 43. This experiment uses the technique of A, fluorescence, B, photosynthesis, C, centrifugation, and D, chromatography.
D.
Yeah, D, chromatography. Why do you say chromatography from the question, from the reading? What gives it away? Chromatography. So look at the word. The word is chroma, right? Chroma.
Is it related to chlorophyll, Professor?
I can hear you.
Is it related to like the chlorophyll?
Yes, related to chlorophyll, but there's a key word here. Chroma. Chroma has to do with color. Color. Chroma. So study of color. Graphy is like study, to study something. The root of words, to study. All right, so chromatography. Chroma. Okay. So in chemistry, you can separate molecules or substances. You can separate substances using chromatography. So what they do is, like in this experiment, you have the chlorophyll, the paper, then the acetone. Acetone is here. They put in the acetone and then the petroleum ether. Those are two things used here. The ether. Then that's the paper. Then what you put the spots of the chlorophyll here. Okay, so usually you draw a line to mark the starting points. Now, if you leave it, what happens is that the chlorophyll is going to, the acetone is going to climb up the paper. And then to separate it into different components. So it's like pouring water. If I have, let's say, a ball here and I pour water in water here, and another big ball, like two of them. Which one is going to move faster? The small one is going to move faster. So it's going to be somewhere here. The bigger one, maybe somewhere there, right? So this is a starting point. So the acetone is doing the same thing, separating the components of this chlorophyll based on the weights. The shorter and the heavier one will move slower, while the smaller molecule will move faster. So you're going to have, at the end, you have different positions for the molecules, as you can see. Then you spray this with a chemical that will give them different colors. and then you analyze it using a standard, like you know that there's a standard that is used, because for every molecule, you know the distance that is going to move. So you're going to compare what you have to the standard one. So let's say if I have this same position as the standard, like I said, this matches that, and so on, you know, and then you can make a conclusion. So that's what the person did here. So the keyword is chroma, the color, chromatography. Now, even if you didn't have an idea of this, you can also do elimination, fluorescence, like something giving off, you know, flashing, giving off some light, you know. Photosynthesis, we know that photosynthesis is going to be plant making their food as out, and centrifugation, spinning, centrifuge, you spin something to separate components. That didn't occur in this question, so that is out. You know. Okay, 44. Say the student should conclude that A, spinach contains two kinds of chlorophyll, green and yellow. B, spinach contains more than one kind of pigment. C, all organic pigments are soluble in acetone and petroleum ether. And D, all organic pigments migrate on filter paper at the same rate.
B.
Which one? B?
Yes, B.
Okay, why do you say B from the question? Why, from the reading, why do you say B? What alerted you to choose B, or help you to choose B? A statement from the reading.
It says that there are several bands of yellow and green color.
Correct. That is the word I want to hear, right? So from the passage, the last sentence says, after a while, he observes moisture creeping up the paper and several bands of yellow and green color. That's the key, several. So A, we cannot choose A, right? Some people will be tempted to choose A. Spinach contains two kinds of chlorophyll, green and yellow. No, they didn't tell us that in the question. They just said several. So all that we can say is that spinach contains more than one kind of pigment. So B is correct. That's the reason. You know. So that's why I said the answers are within the question. If you take your time, you know. All right, great. So those are good experiments to think about. Okay, another one. Let's go to let's see, page. Okay, let's see here. Page 232. 232. Number 16. 232, number 16. It says, a student wanted to test the effect of different sugars on the growth of a certain mold. The sugars to be tested were glucose, fructose, sucrose. 1 gram of each sugar was placed in a tube of 10 ml of water, and a bit of the mold was put in each of the 3 solutions. To add a control to the experiment, the student should also have A, made 2 setups of each of the 3 sugars. B, tested ribose and galactose. C, made 1 setup of just water and mold. And D, kept the 3 setups in the light.
What number is this?
16.
C.
Yeah, so C, correct.
C.
So the first, you have to set up of just water and mold. So that'll be your control. So you eliminate what you want to test. You know, the variable that you're testing for, you eliminate that. Okay. So we just need water and mold over here as a control. Correct. Okay. All right. So let's look at number 18. Number 18.
What is the pace?
232.
232. And what number?
18. So it says, undisturbed layers of rock were examined. Mammal, fish, and bird fossils were found in upper layers. Fish were in the layers beneath those, and neither fish, birds, or mammals were in the deepest layers. This would tend to support the hypothesis that A, vertebrates always coexisted with invertebrates. B, fish were the first vertebrates to evolve. C, vertebrates evolved at the same time. And then B and D, birds evolved before fish.
B.
Right, so B, the fish were the first vertebrates to evolve. Yeah, so according to the experiment that we have here, that's what it represents. So the layers, so we said the fish were in the top layers. No, yeah, so we have fish in the layers below, right? So that's like fish came first, and then that they end up dying, and other organisms came, you know, and so on. That's the implication of this. So B is correct. Okay, let's see another question. Hypothesis question, page 234. Number 25. It says that many people believe that some trees drop their leaves in the late fall because the temperature is near freezing. Which of the following statements least supports this idea? Least. A, maple trees in northern Minnesota drop their leaves in late fall. B, maple trees growing near city lights stay green longer than those far from the lights. C, maple trees pass through a time of near freezing before they bud. And then D, maple trees in southern Florida drop their leaves in late fall. So which one? Yeah, D, correct. You know, so at least supports that, because in Florida it's always like sun, what do you call it? The temperature doesn't drop it to near freezing, but the leaves still drop their leaves in late fall. So it means that that statement at least supports this idea. Yeah. Great. All right, another diagram, another experiment, page 235. So study the chart and then use that to answer 26 and 27. Okay. So 26 says, in which of the following do men expend energy most rapidly? Energy most rapidly. A, light physical work. B, walking outdoors. C, limited walking. And then D, bench work. So study the chart and see which one the rate. You say A. Okay, most rapidly. So light physical work. Let's see. When you go to light physical work, the rate is for men is 4.5. So that is fast, right? So per minute, calories per minute. So that's rapid. That's rapid. Okay, so A, you have light physical work, correct. And then 27, say based on the data, which conclusion can be drawn? So here you want to make conclusion on the experiment. So study the whole thing, look at the men, women, the rates, and then what conclusion can we make? A, it says that the numbers of calories used by men and women are most similar for purposeful walking activities. B, men use calories as rapidly sitting as women do walking outdoors. C, women use calories more quickly than men do when driving a car. And then D, women burn calories more slowly than men do in all activities listed.
D.
Yeah, D, right? So the conclusion is the overall picture that you are seeing. Overall picture that you are seeing. So if you look at all the rates, it's higher for the men than the women. So men spend higher than what's called it. So women burn calories more slowly than the men do in all the activities listed. That's correct, right? So as I said, you can see the answers are just within the question if you analyze it carefully. Don't think about anything when you're doing this type of problems. Focus on just what they're telling you, you know. All right, so let's see. More questions here. Okay, page 239. Page 239. Number 43. Let's look at number 43.
How many chemical reactions occur
239.
more rapidly with platinum as a catalyst?
Okay, it
At
says,
the end of the reaction, the platinum is found to be increased in quantity and changed in weight. Changed in another state.
what's the answer? So many chemical reactions occur more rapidly with platinum as catalyst. At the end of the reaction, the platinum is found to be A, increase in quantity, C, on change in weight, B, on change in weight, C, change into another state, and then D, combined into the final product.
B.
B. Okay, so B, that is on change in weight, correct. All right, so you're talking about a catalyst here. Remember, catalyst speed up the rate of chemical reactions, right? When I say catalyst. So catalyst 1, they speed up rates of chemical reactions. And then 2, they remain unchanged at the end of the reaction. They remain unchanged. Okay, so they just speed up the rate. That's all. That's what they do. In other words, they lower what's called the activation energy. All right, they lower activation energy by increasing rates. It means they lower activation energy. That's what we do. So let's say if we have to take a reaction, for those who have done chemistry, enzymes, and so on, they have the energy levels. Let's say the energy here. And the rate, you see something like this. Now this is called the, so the reactants level, energy level for reactants is here. And the product usually is somewhere here. Okay. So before the reaction can progress, the reactants have to get enough energy. You have to, like a mountain, you got to push them up the hill to get here. Right? The energy that you needed here is called activation energy. This is called activation energy from here to there. Activation energy. When you put in an enzyme, the enzyme will lower the activation energy. It brings activation energy lower. So instead of pushing it all the way up the mountain, now you're going to have it bringing it down. So the activation energy now becomes this here. It lowers it. So the reaction goes faster. You know? So that's why we say that catalyst lowers the activation energy. Okay, so that's what makes the reaction go fast. It lowers the activation energy. So the reaction goes faster. Okay. So the keyword remains unchanged at the end of the reaction. Okay. Right. Now, when you talk about the living organisms, we have catalyst in our body, and the catalyst in the living organism is the enzyme, right? The enzyme. So enzymes are biological catalysts. Biological catalysts. Okay. Today I'm having difficulty in the software here. It's not responding too well. Okay, so it's the enzymes. They are biological catalysts. Okay, so those are enzymes, biological catalysts. Okay, so they speed up the rate of chemical reactions in our body. And remember, enzymes are proteins in nature. Enzymes are proteins. Okay, my pen is freezing. I don't know whether it's my pen or the software. Okay. Enzymes are catalysts. Sorry, they are proteins. Enzymes are proteins. Okay, you write that down. Enzymes are proteins. When the pen comes back, I'll write it. So we can move on. Okay, proteins. Okay, so because they are proteins, they can be denatured, right? Enzymes can be denatured. It means they can be destroyed. they can be denatured. Okay. And then the enzymes work within what we call optimal temperature and pH ranges. Okay. There's a narrow pH that they work in, where they can be denatured. That means they can be destroyed, or the nature can change. It's like proteins, if you boil it, you change the nature, like egg, you boil it, change the structure of the protein. Okay. So they work within narrow temperature and pH ranges. Okay. So there's a, if you take a graph for temperature and activity, let's say temperature, and then the enzyme activity or the rate, it will go like this. You're going to see like a bell curve. So it functions well at this temperature, narrow temperature range. So, same with pH. You take pH, the same thing, narrow pH. Anything outside, somewhere around narrow. If you go too much away from that, it will not work well. The rate will go down and so on. Same for pH. pH also looks like that. And then the rate. Okay. All right, so we can add this little note to what we just said here, the catalyst. So at the end of the day, enzymes also remain unchanged since they are biological catalysts. Okay. All right, so let's see 1 or 2, and then we'll take 2 minutes, 5 minutes break. Okay, so this is good. Okay, let's look at page 242. 242. Number 2. Number 2, another experiment. It says that the next question refers to a historic experiment by Otto Lewy. He placed 2 fresh frog hearts, still beaten in separate dishes of saline solution. The first frog heart was still attached to 2 nerves, the accelerator, which speeds the heart, and the vagus, which slows it. When the vagus nerve of the first heart was stimulated by mild electric current, the first heart slowed as expected. The saline solution from the first dish was then transferred to the second heart, which then also began to beat more slowly. So question says, based on these results, which of the following conclusion is most reasonable? A, the electric current accidentally touched the second heart. B, the first heart's vagus nerve accidentally touched the second heart. C, the second heart was dying because it was not stimulated. And then D, the first heart's vagus nerve released a chemical substance into the saline solution.
D.
Correct. D is perfect. Right. So here you can see that they were not touching each other. You know, they just took a solution, put in another one, and the other one started, beating slowly. So it means that something was released into the chemical was released into that solution that was transferred. Okay, that's all we can say. Okay, so the first heart vagus released a chemical substance into the saline solution. Okay, so you see again, the answer is within the question. Okay. All right, one more here, page 243. Think about psychology. During a lecture, number 8, During a lecture, a group was instructed to write the letter T whenever the instructor said the word right. The instructor tapped the desk every time he said the word right. After doing this repeatedly, he stopped speaking but continued to tap. Many students continue to write the letter T with each tap. 8. Which phenomenon does this experiment demonstrate? A. Conditioned reflex. B. Use and disuse. C. Innate behavior. And D. Habit formation.
A.
Conditional
Yeah,
behavior.
that's a conditioned reflex. If you remember, those who have done psychology, Pavlov experiment with a dog. Yeah, it's a conditioned reflex. You know. So in that experiment, he just anytime he fed the dog, he rang a bell, and then and then fed the dog. Rang the bell, fed the dog. After several times, the dog associated ringing the bell with food. So it just did an experiment where he just rang the bell, didn't give. There was no food available, but then the dog still began to salivate. Because he associated food with the bell. It's a conditioned reflex. Conditioned reflex. All right, so let's look at number 9. Number 9, you have to apply the concept of conservation, the law of conservation of mass. The law of conservation of mass. So if we start with a certain amount of something at the end, you're going to end up with the same amount. All right, so it says number 9, a compound A reacts with compound B to give compound C, D, and E. So A plus B, it says giving us C plus D plus E.
It's B. It's
Okay, so this one was what, 7?
number 9, right?
Yes, and this is 4.
Yes, B. It's
And then this is 2, and that is 3. So you want to find E. We don't know this one. All right. So based on the law of conservation, whatever you started with, the same mass you started with, you should end up with the same mass at the end. Right. So here, if the total mass that we have here is 11, 7 plus 4. So that is 11. Let's see here. So I have 7 plus 4 here. That gives me 11 grams of this on the left side, 11 grams. Whilst on the right side, I have 2 plus 3 plus x. So that's 5 plus x, and that should be equal to 11. So it means that I need 6 more of this. So x is 6 grams. Okay. So it should be B, right? B. The left side, total mass on left side should go to total mass on the right side to conserve the mass. Okay. Great. So I believe I've stimulated enough with the experiments, how to deal with the experiments. Okay. All right, page 246. We're going to round up on the questions after this. Page 246. Okay. Now, if you look at the chart against a graph, So based on the graph, you can answer the questions number 24, 25. It's all based on the graph. So see if you can analyze the graph and count the answers. So at 50 degrees Celsius, the vapor pressure of chloroform is closest to, so you're looking at 50 degrees Celsius. What will the vapor pressure of the chloroform? Based on a graph, what do you get? Okay, so
D.
yes, D, correct. So you have a chloroform is this one. So you read 50, wherever 50, then trace, and then horizontal, read what is here horizontally. So this is about 500, right? So D, 500 millimeters mercury. Okay. And then what about 25? As the temperature of ethyl alcohol rises from 50 to 70, by approximately how many milliliters of mercury will its vapor pressure increase? So we're looking at ethyl alcohol. This one is the ethyl alcohol. And this is the water. So you want to find the temperature, the change in the pressure, vapor pressure between 50 and 60. So 50 and 70. So let me put 70 somewhere here. So what is the vapor pressure at 50? At 50, if you trace this 50 and then go read what is here. So at 50, it's about 200. All right. And then at 70 degrees, 70 degrees, if you trace 70 degrees, it's around 5, let's say around 5, just about 550, all right? 550 something, 60, yeah, around 560 or 70. So if you trace this up and then trace it somewhere, if you trace somewhere, it's about 5 something for the diagram. That's around 550-ish. So they're asking about approximation, all right? So it means that the difference is about 300. That's the closest we have here. So about, yes. It's about 220, yeah, about 300 difference based on if you look at what you have. So it should be C for this question. Okay. Then what about 26? Which of the following particles are nucleons? A, neutrons and electrons. B, electrons, protons, neutrons. C, neutrons, protons. D, electrons, protons, photons, and neutrons.
C.
Which one?
C.
Yeah, neutrons and protons, correct. Okay. All right, good.
Neutron and proton.
Yeah, neutrons and protons. Okay. Okay. All right. So I think if you look at 27, the answer is also in the question. The pH of a solution in which both Congo red and methyl orange produces red is, so I've studied the chart, and a pH in which Congo red and methyl orange. they have the same, they'll produce the same pH.
Number
Both of the red.
27.
Say it again.
Number 27.
27, yes.
Yeah, it's A, 3.
Yeah, so that is 3, correct. So a pH of around 3. Because if you look at the chart, they're 3 to 5 and then 3.2 to 4.4. Red for both. Okay. So again, the answer is in the chart. So that's the exercise I want you to think about. The answer is in the chart, in the experiment. Okay. All right. So I think this is a good point to pause. You've seen different scenarios of on the chart, how to use experiments, make analysis, conclusions, and so on. So a good point to pause for today on the science. All right, any questions before we take a 5 minutes break and then we'll focus on our math today. All right, so let's pause a little bit. What do you get for the first one? Number 30. So you have x cubed is equal to 216. What is the value of x?
B.
Yeah, b. So it's 6 times 6 times 6. A number multiplied by itself 3 times gives you this. So cube root, right? So 6. X is equal to 6. 6 times 6 times 6 gives you that. So here, if you're not too sure, you can work backwards. Choose the answer, multiply by itself, and see if you can get what you give it. So that's back solving.
It's A, it's 2.
For which one?
Number 30.
Number 30?
Yes, it's A, it's 2.
No, 2 times 2 times 2 is 8. You see, you have 2 times 2 times 2, that is 8.
Yeah, I'm talking about the answer.
Yeah, the answer is 6. And
What?
it's x cubed. Which one are you looking at?
You on 109?
Yes, number 30.
Number 30?
Do you have a different question?
Oh, number 30. Yes, it's B, 6.
Yeah.
I got the fuse there, sorry.
Okay. All right, number 31. That's a percentage problem. So what percent of 180 is 225? All right. So remember, if you're not too sure, use a percent proportion. We said part,
Yeah, that's C, 125.
okay, over whole is a percent out of 100. That's the percent proportion, can help you. Okay. And we said a percentage, what percent? So we don't know a percent, so you can say X. out of 100 is equal to, what's the part? The part is the portion associated with the word is. This is the part. So 225. Off is associated with the base or the whole. Off. So that is 180 here. Okay, so this should be the proportion that you have to solve, right? And then you do your cross product, you do a 180 times x is equal to 225 times the 100. And then you divide by 180. Divide by 180. And then the answer is, what did you get? Cross out. And then you can reduce to, either you reduce to lowest terms, or you can just multiply using your calculator. So you're allowed to use it, so you can use it. All right. So you get a 125%. So C is correct, 125. %. Okay, good. All right, 32. But 32, it says in a survey of of community needs, 380 of 1,900 respondents said they wanted purer water, drinking water. What percentage did not request purer drinking water? So the percent that did not. So there are two ways you can answer this question. So try it and give me the answer before we do it together. So how can we find a percentage that wanted?
Is it A, 20%, Professor?
20% that did not want. The question did not want. Right, so those who wanted, that's 38. Yeah,
80%.
80%. You have to subtract from 100.
80%.
Right?
Yeah.
Okay.
80%.
So those who wanted, so that with 380 divided by 1,900 part over the whole, this, if you multiply this by 100, then we get a percentage, right? So if you do that, that's what gives you your 20% who wanted.
So
Now the question said did not. Percent.
Yep.
Yeah, the keyword is did not.
So answer will be 80% or 20%, Professor?
So those who do, that's 100% is the total percentage. So 100% minus your 20%.
Oh, I didn't do that part.
Yeah, so this is the catch, you know. So always maybe underline the keywords in the question so that you know exactly what they're asking. Because if you stop at 20, they'll get you, you know, but the one that I did not, you know. Good. All right, 33. 33, that one should be easy for us to do. Fractions.
C, Professor, 9/16.
Yes, C.
Over 16.
9/16.
Okay. So remember, off is multiplication, right? So 3/4 times 1/2 plus 1/4. That's what you're trying to do. Now, order of operation, you have to work out what you have in the parentheses first. So if you work out what you have in the parentheses, you're adding fractions within the parentheses. So remember LCD. You need the LCD here, which is 4. So since I multiply this by 2, I have to multiply this also by 2. So that'll be 2 here. This is 1. Now, if I add this up, I'll have what? 3/4 times 3/4. Multiplication, nothing to reduce, so we can multiply horizontally. 3 times 3 is 9/4 times 4, which is 16. So 9/16, that is correct. Okay, good. All right, I hope everybody's okay so far.
Yes, everything.
All right. Okay, for 34, I want to introduce you to what we call similar objects, and then you can answer that question. So similar objects also comes up a lot on the test. Similar objects or figures. Now, when I say that two rectangles are similar, it means that they share similar properties, right? And the ratio of the corresponding sides are the same. So let's label this A, B, C, and D. And I call this E, F, G, H. If they are similar in math, what we mean is that the ratio of A, B, the length AB, so side AB to side FE, corresponding side, is the same as the ratio of AD to FG, and so on. If I take the other one, CD, and this one, so BC and EA, the ratio will be the same. And if I take this ratio DC to GH, I should get the same ratio of a constant. And that's what we call the scale factor. It's called a scale factor. Okay. Likewise, if you have a triangle, the same thing. If I have a triangle and I have another similar triangle, the ratios, you compare the ratio of the sides and it should be constant. Okay. Let's happen here again. A, B, C, D, E, F. So the same thing here. If I take the ratio of A, B to the corresponding side, DE should be the same as BC to EF and so on, which is the same as AC to DF. Constant ratio. Okay. So you can use the same idea for this question. Two rectangles are similar. One rectangle has the length 12 and a width of 8. So if the other rectangle has 15, length of 15, what is the width? All right. So think about it like this again. This is 12 and this is 8 centimeters. Excuse me. Then the bigger one, the length is 15 And then say, what is the width? You don't know the width. So you can set up a proportion to do this problem. Okay, so you can say that the ratio of 8 to x, so 8 to the x should be the same as the ratio of this small length here to the big length here, 12 to 15. Okay, then you do your cross product and solve for x. So we have 12x is equal to 8 times 15. Divide by 12, divide by 12. So your x will be equal to, if you reduce to lowest terms, or if you like, a multiply and divide, or just reduce to lowest terms. I know that 4 can go here 2 times, 4 into 12 is 3. 3 into itself is 1, 3 into 15 is 5. So we have 5 centimeters as the answer. You know, so that's it. Where you can solve similar triangles, similar rectangles, and so on. Yeah. The ratios were the same. I mean, some people can also do the ratio of the length to the width. It will give you the same answer. I can say ratio of length or width to length. It doesn't matter. You just have to consistent. You know, I can do this ratio of width to the length, width to the length. I can also do that. Should be constant. So I can do 8 to 12. If I look at here, I can say 8 to 12, width to the length should be the same as when I come here, ratio of width to the length, x to 15. If I do that, I'll still end up with the answer 5. You know, you just have to consistent. All right. Any question on similar objects? How to apply the proportion, ratio, proportion. Okay. All right, try 35 then. 35.
$35.
Yes.
The 35?
Yeah, 35.
Yeah, oh, I got the answer.
What do you get?
I got D.
D. Okay, then that's correct. All right. So here you use proportion, correct?
Yes.
Yeah, so that says a certain drug consists of 2% of a solution. So the drug is 2% of a solution. So you can write this as 2 out of 100. So the 2 is the drug, and then the 100 is the volume of the solution. Well, that's the solution. So you can set out the same proportion. You can set out a proportion based on the ratios. So here I say if there are 300 ml of the medication. So let me make this ml so that we can use the same convention. So this ml, 2 ml of the drug is equal to, set up the same thing here, ml of the drug, should the same thing on the side. So we have 30, the 30, it said if there are 30 ml of the drug available, so 30 ml. So this should be 30 here. 30 ml. of the drug here. We're looking for how many milliliters of solution can be made. So we don't know the solution. Okay, so that's a proportion. 2 over 100 is equal to 30 over x. All right, then you do the cross product. 2x is equal to 100 times 30, and then divide by 2. Divide by 2, divide by 2, just cross out. So x will be 1 here, this is 5, so 1500 ml of the solution, correct. The proportion. Okay. All right, 36. Solving for variables. We call that literal equation, solving literal equations. All right, so here it says solve for H. Solve for H. Okay. So what do you think we should do first? When you have a fraction, it's always good to get rid of the fractions. So in this case, I'm going to multiply both sides by 2, right? So if I multiply the left side by 2, I'll multiply the right side also by 2. Both sides by 2, just once, because it is a single term. So if I multiply by 2, that means these 2 cross out. And then I'll have 2a is equal to h times b1 plus b2. Okay. I want to get h by itself. So to get h by itself, it means that this h is multiplying. So I have to undo the multiplication by dividing. You perform the inverse operation. So it is multiplying, you divide. So I divide this by b1 plus b2. You have together in parentheses.
8.
Whatever to the left side, we do the same to the right side. So this will cross out. Then we have our h left on one side to be equal to 2a over b1 plus b2. Okay, so that's the answer that you want. Okay, so that gives us a as the answer. Okay, so always get rid of fractions by multiplying through by whatever the LCD is or the denominator is. Okay. Any question on this one, how to solve for variables? Okay, good so far. I believe we may see more as we go on. Okay, 37. 37. Try that and tell me your answer.
$37, I got the answer.
Okay, what do you get?
I got B, 126 ml.
126 ml. All right, let me write it down here. Okay, so it's 3 parts of drug A to 7 parts of drug B. A medication has 3 parts of drug A to 7 parts of drug B. If there are 420 ml of the medication, how many ml of drug A are there? All right, so this is a very good question that some people get wrong because they don't read it carefully. All right, so as you said, I'm going to draw this in the diagram form first. The diagram. Okay, so let's put this here, the diagram. So if I have this as my whole, it's been divided into 3 parts and 7 parts. So A, B, 3 and 7 parts, right? So that means that I have a total of 10 parts in all. You gotta look at the total parts here, the total parts. Now I say if there are 420 of the medication, so that's the total. So it means this corresponds to the 420 ml based on this question. And the question is asking how many ml of A are there. We don't know the A. So to set up your proportion, you have to use the A and then the total parts. So I can say that part A to the volume of part A to the whole is what we have to use, part A to whole, right? So I can say that part A to the whole, so which is 3 parts out of 10 parts should be equal to, then the other proportion, the other ratio here will be the total part, that 420 is what you know, you're looking for the part A over here, okay? So this is how your proportion should look like. And then you can do your cross product. Okay, so that is 4 times 10 times X. 10X equal to 3 times 420 divided by 10 divided by 10. And then your X is equal to 126, as she said, ml. Okay, so that's correct, 126. So know when to use the total parts and when to use just the parts, right? If they give me part A and B, and I know part B, and they say find part A, then I have to use 7 to 3, because those are the parts that I know. But here they give us a total. So you have to use a total part correspond to the total volume here based on this question. So use that to solve, to set a proportion. Right. So be careful with this type of problems. Okay. All right, what are 38? 38.
Hello?
Yes.
Yeah, for 38, I got the answer.
What do you get?
I got A.
A. Okay, try that again. Okay. Okay, so she got A. Did anybody get anything other than A? Well, let's do it together and see if we all get A. So first, what did you do? Tell us what you did so I can write it down. What was the first thing that you did? So you have a common factor here, right? So let's factor out the A here, A there. So have A here, factor that out. So A, this will be A.
Minus B.
Minus B, correct? And then here common factor is B.
B.
So you're going to factor B out, B minus A, correct so far? Then we have to cross common factor. But before you cross a common factor, this factor should look alike, right? You have to look alike. How can you make this alike? Think about if I write 2 minus 3, is the same as writing 3 minus 2, but then I take the opposite.
I think we have
negative
to
that.
take a negative, Professor, over there.
Multiply by -1.
Yeah,
Yes, so you switch, right? Good. So we can do the same thing here. So I have our A minus B. If I switch the positions and do B minus A, that means that I have to multiply by -1 in front, right? Good. So this becomes, I'm going to switch the top part to look like this. So it will be negative of A, B minus A all over B, B minus A. So this will cross out, and then you have negative A minus B, as she said. So she's correct. Negative A minus B, perfect. Okay. So that is A, okay. All right, so 39. 39 is an interesting question. So rectangular room has area, rectangular, there's a similar one. So a rectangular room A has area of 400 feet. So the area is 400 feet. So let's call this area 1, 400 feet, 400 square feet. So I'll say area 1, 400 square feet. And so what is the area of a similar rectangular room, the size of which are all half as long as those of room A, half as long. So if this is, let's call length here and the width there, this is half of the length and the width is 1/2. 1/2. Okay. So 1/2 W here. And one, let's call this A2, area 2. That's what we want to find out here. Okay, so let's write an expression for the area, for the first one. So the area 1, what will be the expression? It's a rectangle. So the area of a rectangle is length times the width, L times W. That's the area of a rectangle. Okay. So we know that L times W here is 400. So your L times W here is equal to 400. this is what we know so far, the area for the first one. Now, when we come to this smaller rectangle, what will be the area? We can write out the area again. The area here, area 2, will be equal to 1/2 the length times 1/2 the width. So that will be area 2. 1/2 L times 1/2 W. So area 2 will be equal to what? 1/2 times 1/2 is 1/4 times LW. Okay, so this is what we have so far. Then you compare the two equations. Now, we know that LW is 400, right? That is given here. If you go back, L times W is 400. So you can substitute that in here. So A2 equal to 1/4 times 400. But L times W is 400. And then that gives us 100 square feet. Okay, so that will be the answer for this question, 100 square feet. Right. So if you summarize in a diagram form, it makes your life easy. As you read, you summarize in diagram form. So please take a look at this one and let me know if you have a question on this one. Okay, so I believe everybody got that. Okay, number 40. It said combined with 480 ml of water are 120 ml of alcohol. The percent of alcohol in the resulting solution is, so you're combining 480 ml of water with 120 ml of alcohol. So what's the percentage of alcohol in the resulting solution? Okay. So what do you think we should do here? What should we do? Anybody can volunteer to do it. So you're going to work with the total amount of alcohol in the total volume, right? So you have 120. The total volume here is 480 plus 120. So you have 20 ml of the alcohol out of a total of 600 ml of the solution. That's what you have, percent of the alcohol. Okay. So if you multiply this by 100, then you get a percentage. Okay. So you can reduce to lowest terms, or you can just multiply and divide. My pen is so, there's something wrong with the software today. It's slowing me down.
Is it,
Say that again.
is it will be number B 25%?
25%, right? Yeah, so 60, if you 66, cross out the zeros. Now I think it should be, let me see. If you cross out the zeros, you have zeros, cross out 6 into, that's 20 here.
20%.
It's 20%. It's because the zeros to cross out. then 6 years 1, 6 years 20. So you have 20% alcohol. 20%. Okay. Right. Let's try more problems. Page 111. Let's try number 1, 2, 3, 4, 5. Right, because some of them will be fast to do, so we can skip that one. Okay, at least number 1, we know that we can do that quick. Page 111. So when taking a pulse of the patient's pulse, the nurse counts 23 beats in 15 seconds. How many times will the patient's heart beat in 1 minute? We saw a question like that. Either you use proportion or can use just regular arithmetic approach. So what answer do we have? 23 beats, 15 seconds. So set out the ratio. You want the beats. We don't know. 1 minute is 60 seconds. So the units too much. Yeah, 92. Got 92. All right, so it's 15x is equal to 60 by 23. Divide by 15, divide by 15. So x will be 15 here is 1, 15 here is 4, and then you have 92, correct. Or if you want to work with regular arithmetic, you know you have 4 15ths out of 1 minute. It's out of 60 seconds, so 1 minute. So 4 of that, so 4 times 23. And then you can also work with that. All right. Okay, number 2.
C.
You got C for number 2?
Yeah. Let's see.
Okay. What do you do for number 2?
I did like 3y equal to 2x plus 8, and
Okay.
then I put over there the x value 2 into
Okay.
20 plus 8. 3y
20
equal
plus
to
8.
20 plus 8. Then 3y equal to 48, y equal to 48 over 3 equal to
Correct.
60.
Correct. Great. So what she's saying is that you substitute the given, they gave you x. So you substitute into this, and then you can solve it. Okay, perfect. So y is equal to 16. Excellent.
Professor, I didn't get this one. Can you review it a
Which
little?
one? Number 2.
Number 2.
Okay, number 2, they gave you the value of x, right? They gave you 3y is equal to 2x plus 8. That's what is given. Now they said that x is equal to 20. Find y. So wherever x is, you substitute 20. So I have 3y is equal to 2 times. So I put 20 in place of x plus 8. Multiply the 20 out. 20 times 2, that's 40, plus the 8, equal to 3y. 40 plus 8 is 48, is equal to 3y. How do I get y by itself? I have to divide both sides by 3. So I divide the left side by 3, divide the right side by 3. So the 3 will cross out. They have y is equal to 16. You got it now?
Yes, thank you.
You're welcome. Okay. Okay, number 3, I believe number 3, you should all be able to do that. All right, so I think number 3 should all be able to do that one. So let's skip to number 4 so that we can review the fraction. Unless somebody has a question on number 3.
Number 3 is B, 79.
Okay.
0.248.
Yeah. So you can use your calculator since you're allowed to use it, or you multiply them out and count the decimal points from the left and from the right side towards the left. Yeah.
And I have number 4 too.
Okay.
It's C.
You have C for number 4.
Yes.
I also got C, Professor.
Okay. All right. So let's do that together for the sake of those who have forgotten this one. So since you're adding fractions, remember we said you need LCD, right? For addition of fractions. So the LCD, 20, you have 4 and 5. So the LCD will be 20. So you have 20 here. Yeah. Okay, so this is 20 here, plus 2, this will be 20. So you're multiplying this by 5 to get 20. So this also times 5. So that'll be 15 here. This is times 4 to get 20. So also 4 here. So that will be 16. Right, so now we can add the numerators of the fractions. So you have 31 out of 20, and then add the whole numbers, then this is 5. But we cannot leave the 31 out of 20 like this. We need to change to a mixed number. So to change to a mixed number is with 20 divided into 31. So that gives us one whole number and then remainder 11. So this is one whole number, 11 out of 20 left, right? This is what we get, right? So what you do is that you're going to add the one whole number to the 5, right? So that we'll have 6 whole numbers and 11 out of 20 parts left. So this would be the answer, 6, 11, 20. So C is correct. You are C, that's correct. Okay, good. And number 5, what do you get for number 5? Volume.
I have A.
A, all right, that's correct. So it's a cube. So if I have a cube, the volume of the cube is length times width times the height. Length times width times the height. That's how you find the volume of a cube. So we have to multiply all the numbers. 12 by 15 by 8. So that gives us the 1440. And the unit, always what the unit? Volume is cubed. Volume is cubed. Because sometimes they can trick you. Here the numbers were different, but they can also give you, they can write 1440 centimeters, 1440 centimeters squared, 1440 centimeters cubed. You know, all this to confuse you. But in the volume should always be cubed. Cube. You're multiplying the centimeters by itself or the unit by itself 3 times. So it's cube. You know, if area, they have to be squared. If it's perimeter, they have to just be the units. You know, so watch out for the units as well. Okay. All right. What are number 6? Number 6. Okay. Which of the following fraction has the largest value?
D.
B. Okay, let's see how you did it.
It's D.
Oh, said D. Okay.
Yes.
All right. So let's see. So the first one is 1 over 5 times 3. So that is what? 1 over 15. The second one is 1 over 5 plus 3. So that is 1 over 8. And the third one is 1 over 5 minus 3, 1 over 2. And the third one is 1 over 5 divided by 3. So here, this is the same as saying 1 over 5 times, sorry, 1, oh, my pen is acting up again. So this is the same as saying 1 over 5 over 3. Five over 3. Okay. Come on, the software, it's responding slowly today. Okay, we're going to round up on this one. So, okay, so this 1 over 3. So this means that you have 1 divided by 5 over 3. That's what that means, right? This divided by this. So we end up with 1 times 3 over 5. So it's 3 over 5 for this particular one. So we are comparing these 3 fractions, sorry, 4 fractions. 1 over 15, 1 over 8, 1 over 2, and 3 over 5. Okay, and say which one has the largest value. Okay, so obviously we know it's 3 over 5. How do you do this? To compare fractions, usually you can use LCD. You write all of them with the same LCD, and they can compare the fractions. Okay, but one quick way that I use is to examine the numbers. If I have any number, let's say if I have 10, what will be half of that? Half of that is 5. So 5 over 10, the same as 1/2. If I have 20, half of that that's 10. So this is the same as 1/2, and so on. So when I come here and I examine the numbers, I'm going to compare them to 1/2 and see, compare to 1/2 and see which one is bigger than that, right? I'm using as a standard here. Now, 1 over 15, this is smaller than the 1/2 here. So it's out, right? Half of that will be 7.5. Now, 1 out of 8 is less than 1/2 because half of this is 4 out of 8. That gives me exactly 1/2. So this is small compared to 1/2. So it's now between this and that, right? So let's compare. What would be the same as 1/2 out of 5? So for 5, to get half, after that, it's going to be 2.5 out of 5. That will be exactly as 1/2. But if I compare 2.5 to the 3, this is 3 out of 5. So it means 3 out of 5 is bigger than this 1/2. So this is bigger than the 1/2. So that's why the answer is 3 over 5. Okay, you can use that approach quickly to find out which one is bigger. You know, other than that, you have to use the longer way. You find the LCD, write each of them with the same LCD, and compare the numerators. Okay. Yeah. But this is one quick way examining if it's greater than the 1/2 here. Okay. All right. So I think we should be able to finish up 7, 8. Do you want to finish up in 5? Do you want to give 5 minutes to finish? Or you are tired?
We could finish it.
Yeah, so I want that, so that we have like a round figure and then finish up. We continue from 13. So maybe 5 minutes will be enough for us to do this. So like for number 7, it says it says a group of 25 runners recorded a total weight loss of 225 pounds after completing a marathon. What was the average weight loss per person? So you find the average weight loss per person, average weight loss per person. How do you think we should do that one?
225 over 25.
25, yes, over 25, correct.
Other number D. Other D is 9.
Yeah, so 9 pounds per person, correct. So that one was, you divide the total by the number of persons, correct. So that is good. And then number 8, how many seconds are there in 3 1/3 minutes? We can do that in like 30 seconds too.
Yeah, the A. 8.
Okay, so 3 1/3 minutes in terms of seconds. So we can change, a quick way will be to 30 seconds is how many? 3 minutes is 3, in terms of seconds is 3 times 60, right? 3 times 60 times 60. So that's 180 minutes. And then 1/3 of a minute will be 1/3 of 60, which is 20. So if you add the 2, then we get that 200 seconds. Okay. So that is one approach to do this. Or you can just multiply 3 1/3 by 60. It will give us the same answer. 3 1/3 by 60. So 30, 60 here. So that's 20, and then add this up. 20, 200 seconds. Okay. Or, as I said, you multiply 3 1/3 by 60, and we should arrive at the same thing. So that one I have to change in proper fraction first before you can multiply by 60. Okay. Or 3 1/3 times 60. And 3, that's 9, that's 10 over 3 times 60. And then you have 3 here, 1, 3 here is 2, 0. And then have 2. Okay, we can do both ways. Okay. All right, good. Number 9, we're almost done. Which of the following equals 0.18? Which of the following percentage equals 0.18?
I have A. It's 18%.
Yes, 18%. So you multiply the decimal by 100. So 0.18, you multiply by 100 to change to percent. In other words, you move the decimal points 2 places to the right. Scale 1, 2 to the right. So that is 18%. Okay, it's 18 out of 100. Perfect. Okay. I believe number 10, you should be able to do that yourself, dividing the decimals. You should be able to do that if you have to use a calculator. But without a calculator, then you have to use a long division. long division without calculator.
Professor,
Yes, please.
can you do that for us, please? Number 10, long division. One example.
Okay, so 3.45 divided by, let me write it this way, 3.45. So before you can divide this, you have to move the decimal, you have to make the denominator a whole number, all right? So we're gonna move 1, 2, that's you're multiplying by 100 here to make this a whole number. So it becomes 15. Whatever I do to a denominator, do the same to the denominator, 1, 2.
23.
Okay, so you have 3, 4, 5. 345 out of divided by 15. So this is what you have to divide, right? Once you make the denominator a whole number. So
Yes.
15 and then divide this. So 15 into 3 is impossible. So you add a 4. 15 divided by divided into 34. That would be 2. Multiply, that's 30. Subtract 4, bring down the 5. 15 into 45, that is 3. So 3, and then you multiply and subtract again. Okay, let's see. So this will be 3 here, and this is 45. Subtract, nothing left, right? So the answer is 23. So that would be the long division.
Okay, Professor.
Yes.
And then we have to multiply it by 100, right? To get the 0. Oh, okay, got it.
Yeah, yeah.
Okay.
So you're removing the number 1, 2, that means it's times 100.
Yes. Okay.
Yes, that's what that means, yeah.
Okay, thank
If you
you.
move 1 place to the right, it's times 10. 2 places means times 100, and so on. 3 places times 1,000.
Okay. Yeah.
Okay, and then we're almost done. So we can do number 12 is similar to number 12. You can just divide, you know, like either calculate a long division like I did for number 12. So let's finish with number 11, and then we can try number 12 yourself when you go. All right, so number 11, that's another type of problem, percentage increase problems. Percentage increase problem. I think we saw one last week. So the cost of the medication, so the price of a certain medication is $850 per bottle. If the price increased by 7%, how much will a bottle of medication cost? So 7% increase.
I have B.
You have B. Okay, yeah, that's correct. B is correct. Okay, so just take us through that one, and let's see whatever you did. 2 steps to this problem. So what was the first thing that you did? What was the first thing you did? Can you take us through what you did? All right, let's do this. So you first have to find 7% of the 850, right? Percentage. So 7%, that means 0.07 times 850. I'm working in decimals. So times the 850. So my pen is acting up again. It's a software that is trying to reload itself. Okay, so 850. So 850 here. So you're going to multiply by 850. Okay, it's acting up again. Okay, let me just talk and then we'll pause here. So the first thing is to multiply 0.7 by the 850, and then whatever you get, you add it on to the 850, and then that'll give you the 910 as the answer. You know, yeah, 850. Something happened. All right. Okay, so you can write that down. Since my software is not responding too well today. So multiply by 0.07 by 850. Whatever you get, add it on to the to 850, and then you should get the answer. And which it should be 910. That's the correct answer. Okay. All right. So I think we'll end here. We'll